Hi, and welcome to 5 Minute Video Studies for the NCE. Today we are going to cover the clinical focus, and we are going to cover subcategory D, which is bullying. Now, this word, some clinicians have probably said it's being overused nowadays, but the definition of bullying refers to unwelcomed or unrequested acts of violence, aggression, intimidation, harassment, verbal abuse, social exclusion, or general or sexual coercion done with the intent to cause physical or psychological harm. Many lay people confuse bullying with picking or teasing. So it's important as a clinician to understand what those differences are. To me, it's a persistent, continual harm. If two classmates have a disagreement, or if one classmate starts teasing, then that's not necessarily incident of bullying. That's just more, making fun of or a put down. Whereas bullying is something that is persistent, and causes a great deal of physical or psychological harm. With both children, adolescents, and adults, you can see bullying in a variety of ways and settings. You can see it in work areas for many adults. In children, you frequently see it in schools. You may even see it in things like sports teams or other organizations. And it's important to remember that many times individuals in the minority, such as race, religion, the gender spectrum, those are more likely to get targeted, as well as individuals with a disability, and a lower income. So, as a counselor, you have to keep that in mind, that bullying is something that happens. It can happen throughout the lifespan. Some of the signs and symptoms of bullying are stolen or damaged property, unexplained bruises in the body or cuts, mood disturbances, rage, something called frequent accidents. So that just means that the client is telling you frequently that they fell or that they had some sort of an accident. Other things could include social withdrawal, so isolation, not feeling like they belong, not feeling welcomed, as well as eating and or sleeping disturbances. So all of those are different symptoms. As a counselor, it's important to talk about the different power dynamics that are going on, the different, how complicated those dynamics can be. And it's important to create an outlet for that emotion, whether it's rage, whether it's frustration, whether it's sadness. All of that leads to the behavior. It's also important for the client to understand the importance of a support network. And whenever we talk about bullying, um, it's important to understand the bystander effect. So, understanding that when someone sees it, the more likely that they are to speak up, then the more likely they are to understand that they can make a difference. And that's part of that empowerment. So that's just a general overview about the notion of bullying.